before I present my recommendations, I want to ask you a question. Is now the right time in your life to address what's going on in your mouth, ideally? And stop. Let's say you have a patient that is middle age or older, and there's a lot going on in their mouth. It's apparent to you that there's a lot going on. Now, a lot of doctors struggle with, what do I do? Do I present the whole enchilada, or do I just take it piece by piece? And there's a rather famous quote from Wayne Gretzky. Now, Naren, you ought to be pretty well versed in Wayne Gretzky quotes because you're from the great white north of Canada.
Yes.
And that quote that I'm referring to is, you miss every shot you don't take. So what I want to encourage you to do is to present ideal treatment, but present it in a way that will be more effective. So watch this. So let's say you're that patient, Naren, and there's a lot going on in your mouth, and I'm going to have a dialogue something like this. Naren, first of all, it's been great to meet you today. Thanks for choosing our office for your dental care. We're going to work really hard to take great care of you. Glad you're here. Now, I've had a chance to look at the records that we took today, some photos, some radiographs. I've had a chance to kind of get to know you as well. And I'd like to share with you some suggestions that we can do to help improve your oral health. Now, before I do that, though, Naren, I want to ask you a question. First of all, it's apparent to me, and it may be to you, that there's kind of a lot going on in your mouth. And we're going to look for some nodding the head, some recognition. Most of the time, say, yeah, I know. Something like that, right? So, Naren, it's apparent to me, and probably you, that there's a lot going on in your mouth. Now, before I present my recommendations, I want to ask you a question. Is now the right time in your life to address what's going on in your mouth, ideally? And stop. And stop. Is now the right time? Now, you'll be more effective if you could relate it to something you know about that patient. Hypothetically, Naren, you've shared with me that you've got one daughter in university and another shortly going into university. My kids are out of college, thank goodness, but I remember when I had multiple kids in college at the same time. So let me ask you a question. It's apparent to me there's a lot going on in your mouth, and maybe apparent to you as well. We look for the recognition of that. They'll nod their head and say, before I present my recommendations, I have a question to ask. Is now the right time in your life to address what's going on in your mouth, ideally, especially with regard to, soon having two girls in university? Is now the right time? And then just listen, because what might you say?
I might say, yes, it is the right time. I might say things like, for these types of things, this is the right time, but for those things, I want to wait.
Yeah,
there could be a whole range of answers. Or I might say, you're right. Let's talk about it in a couple of years.
I mean, a couple answers. You might say, well, as a matter of fact, that college tuition is looking me square in the eyes, and it's not ideal. And by the way, if that was the case, I'm going to say something like, Naren, let's do this. Let's take care of the immediate concern on your upper left. So we get that taken care of. I'm assuming there's something more immediate that needs to be taken care of. Let's take care of this immediate thing up here. And then I would like to get your commitment to visit our office regularly for your hygiene visit. Now, Naren, your gums are nice and healthy. So that means we'd like to see you about every 6 months. And I'd like to get your commitment to keep those appointments, because if we see you every 6 months, I can keep an eye on things. And then we can simply revisit this periodically, and we're ready when you are, when the timing's right. But make that extra conversation about getting committed to hygiene.